Hey there, my curious viewers. Today, we're diving deep into a topic that has shaped human history in significant ways: pandemics and epidemics. From the ancient world to the present day, these infectious diseases have left lasting impacts on our society, and it's crucial to understand their history to make sense of our present situation. So, grab a cup of tea and let's explore. Let's kick things off with one of the earliest recorded pandemics, the Antonine Plague. This deadly disease struck the Roman Empire during the 2nd century AD, causing devastation throughout the Mediterranean. Historians believe it was likely smallpox or measles, leading to a staggering death toll of around 5 million people. The Antonine Plague weakened the empire, making it vulnerable to invasions and ultimately contributing to its decline. Fast forward several centuries, and we encounter the infamous Black Death. From 1347 to 1351, this bubonic plague ravaged Europe, Africa, and Asia, claiming an estimated 75 to 200 million lives. The Black Death had far-reaching consequences, profoundly impacting social structures, economies, and even religious beliefs. The devastation caused by this pandemic was truly unparalleled. Moving closer to modern times, we can't ignore the Spanish flu. Despite its name, this deadly influenza outbreak happened between 1918 and 1920, during World War I. The Spanish flu infected an estimated one-third of the global population and claimed the lives of 20 to 50 million people, more than the war itself. What made this pandemic particularly concerning was its ability to affect young, healthy individuals, which was uncommon for influenza viruses. The Spanish flu left an indelible mark on public health policies and research. In the latter half of the 20th century, we faced another global health crisis: HIV/AIDS. First identified in the early 1980s, this pandemic has had a profound impact on millions of lives, particularly in sub-Saharan Africa. To this day, HIV/AIDS has claimed the lives of over 35 million people worldwide, making it one of the deadliest pandemics in history. The response to HIV/AIDS led to significant advancements in medical research, public health campaigns, and the fight against discrimination. Now, let's shift our focus to our present reality: the COVID-19 pandemic. Although it may feel unprecedented, it's crucial to recognize that pandemics like this have occurred throughout history, and COVID-19 won't be the last of them. Just as our ancestors faced challenges, we too must adapt, learn, and grow from this experience. The impact of these pandemics on our world today cannot be overstated. They have reshaped societies, influenced scientific research, and transformed the way we approach disease prevention and control. For example, the devastation caused by the Black Death ultimately led to labor shortages, which in turn changed the dynamics of the feudal system, leading to a gradual shift toward more equitable social structures. Similarly, the lessons learned from the Spanish flu greatly influenced our response to subsequent influenza outbreaks, such as the H1N1 flu in 2009. The scientific advancements and public health measures put in place since that time have allowed us to respond more swiftly and effectively to the current COVID-19 pandemic. It's essential to remember that pandemics are not isolated events. They are interconnected with the social, economic, and political fabric of our world. Factors such as urbanization, climate change, globalization, and population growth contribute to the emergence and spread of infectious diseases. By understanding and addressing these underlying factors, we gain the tools to mitigate future pandemics. So, where do we go from here? It's crucial to invest in robust public health systems, prioritize scientific research, and emphasize international cooperation. We need better surveillance and early warning systems to detect emerging diseases swiftly. Additionally, we must continue to resource and support initiatives that prioritize vaccine development and distribution to ensure equitable access worldwide. In conclusion, understanding the history of pandemics is key to comprehending the impact they have had on our world and how we can navigate future challenges. From the Antonine Plague to the COVID-19 pandemic, these infectious diseases have shaped societies, changed the course of history, and spurred medical advancements. Remember, we are not alone in facing these crises, and by working together, we can build a healthier and more resilient future. Stay curious, stay informed, and stay safe.